But if we can make your body healthier, just in general, starting at your feet and working all the way to your head, you say, if I've optimized your physiology, that makes you healthier. And if you're healthier, you're less sick.
Welcome to The Healing Blueprint. I'm your host, Jill Briansky. On this podcast, I speak with experts from traditional and holistic healing modalities. And together, we share insights, tools, and practical guidance so you can create your own healing blueprint. Let's move into today's episode and get started. If you've ever felt frustrated bouncing between multiple doctors who aren't connecting the pieces, this episode is for you. We're talking with William Foley, a doctor of osteopathy, about a more integrated approach to understanding and healing the body. Bill, thank you for being with us today.
Thanks for having me, Jill.
Can you tell us basically what it is that you do? What is a doctor of osteopathy or a DO?
Sure. In this country, in the United States, there are two types of fully licensed physicians. There are MDs and there are DOs. And so I'm a DO, doctor of osteopathy. More modern term would be doctor of osteopathic medicine. And so just like an MD, we go to medical school 4 years. We specialized doing a residency or a fellowship. And basically, we have all the same rights and privileges as an MD, legally, professionally. In fact, even in Massachusetts, there's about 1,500 osteopathic physicians out there. And so it's likely you've seen one and maybe didn't know it. The difference, of course, which is the most important part, the difference between a DO and an MD is that we have a different philosophical approach to medicine and a different training that includes a type of hands-on treatment that we call osteopathic treatments.
What do you do with the hands-on?
That's a good question. So first, the osteopathic manual medicine or manipulative medicine is really based on that philosophical approach. And the philosophy is simple. It's something that I think every listener would agree with, which is that the body has its own ability to heal itself. It's always self-regulating and it's always trying to move towards normal. The other part of our philosophy is that you need to treat the whole patient, which certainly in this modern era of alternative medicine, considering holistic care, and everyone really wants that. No one wants to be treated as a part. But osteopathy, over 100 years ago, the founder came up with the idea that you need to look at your patient from head to toe. You need to think about the mind, body, and spirit. You just can't look at them one-dimensionally. And then finally, which is the big one, is that anatomy and physiology are interrelated, meaning that our structure and our function is really the same unit of function. So if you want to function at a 100%, in other words, you want your cardiovascular system, your digestive system, you want to sleep well, and you want to feel energized. Well, one of the ways you need to work at this is through your anatomy. So if you want perfect anatomy, if you want perfect function or physiology, you need to improve your anatomy, as well as your biochemistry and your mental health and all that as well.
So when someone wants to improve all that and they want to have better anatomy, what kind of things would they come to you with? They're not going to say, hey, I want to change my anatomy.
That's right. So because we're a parallel discipline of medicine with MDs, truly you can come to an osteopathic physician for anything. And that includes the hands-on work. To be fair, at least half of my patients come to me for musculoskeletal problems and pain. But that's also true of most primary care doctors. If you look at the literature, 1/3 to 1/2 of all primary care visits are due to pain. So yes, I treat back pain, neck pain, arm, leg, knee, elbow, any joint you can think of. That's the type of pain that I see. But it also includes migraines and tension headaches, fibromyalgia, other functional pain disorders. And so that's, again, what I would say is about half of my day. But then there are people that come in with neurologic problems. They come in with gastrointestinal problems like, Crohn's disease, irritable bowel syndrome. They'll come in with respiratory problems, or even in kids, they'll come in with recurrent otitis media or recurrent ear infections. And there's literature to support that osteopathic treatments help this. Now, the idea isn't that I have a cure-all for everything. That's not what I'm saying. But the hands-on work is part of what I do for everyone to help them reach, optimal health.
So if I'm hearing this right, you see them as a doctor, as a physician, right? So you see them as a medical professional, and then you add in this hands-on piece.
Exactly. And so, I mean, if you want to think about it in a concrete example, so somebody comes in with a very common complaint, irritable bowel syndrome. They feel a lot of aches and pains and cramping, and they're bloated. And so, of course, they come in as a doctor. I do a full medical exam to make sure that it's not something else, that it could be more serious. You want to have the right diagnosis. But then from there, we start with our least invasive treatments and we work our way up to the most invasive. So it's not that I'm against medications. It's just that a lot of times we hit people with medications for every problem they have. So they have a minor problem, but we're hitting them with a major treatment option. So with a digestive issue, it would start with a lot of discussion over what are you eating? Are there foods that could be contributing to this? Do you need probiotics? Have you had a lot of antibiotics in your life that have kind of ruined your normal gut flora? And then from there, for the hands-on part, which is what people probably want to hear about, is you start thinking, well, wait a second. The sympathetic innervation, which is part of the nervous system, to the gastrointestinal tract, is about T6 to L2. And you say, oh, well, what if there's compression and restriction in that area so that those nerves are not able to work optimally? It's not necessarily they're not working, because, of course, we're still digesting food. But can we optimize our patients? And the same thing could be thought of from the vagus nerve, which is the most famous nerve in the 21st century, and everyone talks about it. But not only are there ways to stimulate a vagus nerve that we know through exercise, and we have vagal nerve stimulators that people are using now, but really there's anatomy, and you can get compression of that vagus nerve through where your head meets your neck, called the occipital-atlantal junction, also through tight muscles in the neck like the scalenes or the sternocleidomastoid. So there are ways to really access these physiologic or ways to optimize your physiology through these anatomical landmarks.
So you start least invasive, right? You do a diagnostic, you get an idea of what's going on with this person. I love the fact that you don't start with the medication, because what I see a lot of, which I'm sure you see a lot of as well, is people that have gotten medication and now they have all sorts of side effects from the medication, and it takes longer to get to the root of that issue. So I love the fact that you do more hands-on body diagnostics. So what if somebody started with probiotics? Let's just go back to your example. They start with probiotics and they're not really seeing much of a difference. What would be the next escalation, I guess, or the next move in that?
Yeah. So for us, where we work at our office, we always start with lifestyle modifications and osteopathic treatments. Pretty much everybody gets that. And the lifestyle modifications for a gastrointestinal problem are usually pretty straightforward. But you need to think about the 5 essentials of life. And so we need to breathe. We need to drink water. So many of us are dehydrated and holding our breaths. Food. And I think that your audience is probably right on board with how polluted our food is right now, with the chemicals that are in it and hybridization, genetically modified food. So we're always working at that. We work at, the major foods that cause inflammation in the body, like I should say non-foods. By artificial colors and flavors, but also things like sugars, preservatives. And then, of course, we talk about, alcohol. Maybe you have gluten, dairy sensitivities. But then from there, you need to get an osteopathic treatment. And the idea of an osteopathic treatment is not that I have a protocol put aside based on what your diagnosis is. What we do is we put our hands on the body and we're trained to listen. We're trying to listen to see how the body's working. Are there myofascial strains? Are there ligamentous articular strains, which is in the joints? Is there poor neurovascular flow, meaning we need good arterial or oxygenated blood flow to the tissue so that it gets nutrients? We need to drain venous and lymphatic flow to get the metabolites and the inflammatory compounds out. And we also need to make sure we have good neurotrophic flow. The nerve sends signals to every tissue in the body, and every cell in the body needs to get that signal about what it needs to do to be healthy and to operate efficiently. And so the techniques, which everyone always wants to hear, there's thousands of techniques. There's no way to go over all the techniques in one session, but they're generally very gentle. It's a very gentle hands-on approach to relieve those restrictions in the body, remembering that the body is trying to relieve those restrictions on their own. So how do I help it? And so a lot of times osteopaths like me will say, well, I listen with my hands. I don't hear voices, but I do put my hands on and I feel those tissues and they want to move in a certain direction. And generally when you do that and you help to unwind the body, you get more efficient physiology and all of a sudden people start to get healthier.
As you're talking, what's popping through my head is probably one of the most famous DOs, I think, who created, or I don't know that he created it or discovered it or put it into words, this craniosacral therapy. And the same thing, sort of listening to the body, listening to that, the tissues and that gentle, quiet pulsing or energy flow as you're talking about. Is that something that you're familiar with? Is that something that all DOs do without necessarily using the term craniosacral? Because I know a lot of people are using craniosacral terminology lately.
Sure. Well, so we have to go back a little bit in history to answer that whole question. William Sutherland D.O., who's an osteopathic physician and one of the students of A.T. Still, the founder of osteopathy. So he is the discoverer and founder of osteopathy in the cranial field, as he titled them. And in the early days, sometimes it was nicknamed cranial or craniosacral, but craniosacral therapy is a little different. Craniosacral therapy was started by John Upledger, who was also a DO. He was an osteopath. And what he did was he took that osteopathy in the cranial field and he altered it, he changed it, and some people say he watered it down a little bit because he wanted to train non-physicians. And so originally he was training physical therapists and massage therapists, and then it's transformed into what it is today. So there is a lineage, there's a history of where they come together. But you're right, osteopaths don't say craniosacral therapy. We will say we do cranial osteopathy, or as I said, the long version, osteopathy in the cranial field. And you're absolutely right. It's the idea of listening to the body, and in this case, the cranium, to the head. Dr. Sutherland was always clear to say that he wasn't creating a new form of medicine. He was talking about osteopathy as it pertained to the head, to the cranium itself, because he thought that it was something that wasn't being looked at a lot. But he did give credit to his teacher, A.T. Still, as a person who influenced him and pushed him on his way in this direction. But yes, I would say that I wouldn't say all osteopathic physicians do cranial work. Just like I wouldn't say all osteopathic physicians practice the way that I do. Most osteopathic physicians practice like MDs. And that's the truth of the matter. In this country, because of pressures from hospitals and insurance companies and really just economically, most DOs practice like MDs. But those of us who practice like this in traditional osteopathy, sometimes they call it osteopathic manipulative medicine or neuromusculoskeletal medicine. Just for those who hear those terms, most of my friends, we call ourselves traditional osteopaths. And yes, pretty much all of us will do osteopathy in the cranial field because it would be like skipping the elbow or skipping the spine. You can't skip the cranium. And because it's a really good question, Jill, because I get that a lot. I get a phone call and say, do you do lymphatic work? Well, if it's part of the body, I definitely do it. But then I'll get another question, which is, well, do you do visceral work? And the answer is absolutely.
And I think people are asking those questions because, as you're saying, it feels like you're sort of a lost art form here. Like a lot of people who trained in your field are no longer practicing, if they ever did practice, what you're, true traditional osteopathy. And it's kind of a shame, I think, that your field has, I'm going to use a term that you used earlier, almost sort of like gotten watered down or forgotten about in a way. And I'm wondering why you continue it when so many of your peers have drifted.
Yeah. Well, I do this because I love it. I didn't become an osteopath because I was limited in my options of what I could do with my career. In fact, when I was much younger, I was on my way to get an MD, in fact, an MD PhD. I was a chemist. I really wanted to do medical research, but I met an osteopath and it kind of changed my career path. And so here I am. So I've always stuck with it because it's the reason why I went to osteopathic school. Now, with that being said, I hear what you're saying about it. It's a shame that there's not more of us out there, but at the same time, there are people who will argue, and they might be right. I'm not a numbers person, but they might be right in that because we have so many more schools and we really are graduating lots and lots of DOs. We're the fastest growing healthcare profession in America right now. So even though the ratio seems to be more osteopaths practicing like MDs, there's still just a lot more of us out there. So I don't know the real number, but I would say that probably in every state, you're going to find some real traditional osteopaths. There's people with really good skills everywhere. And I don't know that we have necessarily less numbers in total than we used to have. It's just that ratio seems to be getting less and less because, when I started my practice in Massachusetts, there were much less than 1,000 DOs in Massachusetts. And like I said, now there's over 1,500 and growing. So I think that's possibly where we see it from. The other thing is, I think it's really hard to be a traditional osteopath. I mean, in its truest form, it's a philosophical approach to medicine, meaning you really need a medical degree to be able to, in the full scope of it, talk to patients about how they can heal and how they can get better and understand when medications may be overprescribed, which all doctors agree there's an overprescribing of medications out there, but also to have the education behind saying, okay, that is too much. Or, you have had 2 heart attacks and I'm not telling you what to do, but these medications might be saving your life right now. Like that sort of thing, be able to have that. The other hard part is that, medicine has really gone corporate. This is a whole different discussion, but they're big hospitals. They're owned by major corporations that owns other hospitals. And I feel for doctors because I went through it. I think they're coming out of medical school now with $500,000 in debt. I came out with $250,000 in debt. And so it's really enticing when a hospital system offers you a job, with a salary and benefits. And it's no different than any other job where people are trying to be employed because there are benefits to it. But for what we do, we're all, for the most part, that's changing a little bit, but we're mostly self-employed. And so it's that scariness of, especially when you start, I don't know what I'm going to get paid and I'm going to have a lot of debt even without getting a small business loan. So I feel for people, but in the end, because I do see a lot of passionate young people going to school, just getting out of school, I think we're in good hands. One of my teachers, Ann Wales, who was a student of Sutherland's, and she lived into 101. So she had a lot of experience. When we would discuss the downfall of osteopathy and the death of it, she would smile and say, we're always going to be a small number of people because it's not mainstream. And it's unlikely to be mainstream because it's not an easy route. Taking a medication really is easy in comparison to changing your lifestyle and working on your health.
I'm sort of going to argue with that.
Sure, you can.
Is it easier to take a pill than work on that stuff in the short term? Yes. In the long term, it really isn't.
Oh, I mean, I agree with you there totally, Joe. And obviously, because it's what I do for a living, I'm constantly trying to help people on that road to health. I mean, one major difference between an MD and a DO, just philosophically, is that MDs are trying to fight disease and defeat death. And a traditional osteopath is really just trying to help restore health and put you on the road to health, which is very different. When I first started as a young man, I thought this kind of semantics, right? If you get healthier, well, you're less sick. But it's not necessarily true that fighting disease is the same as getting healthier. And most of what we do in allopathic medicine is manage diseases. And I'm not knocking it, but because I was a primary care doctor for many years, and it's very hard to get diabetics to change their lifestyle. It's very hard to get obese people and and even smokers and drinkers and all these things we do to ourselves, and some of them are praised by society, right? The overworkers, the perfectionists, the people who are stressed out all day and they're thin and doing yoga, but they're having heart attacks because there's so much cortisol from all that stress. So there's a lot culturally, there's a lot societally that's happening, and I think you're right. If we could move all of society towards health, I think what we would see is actually we'll be just as productive but healthier at the same time, maybe more productive.
And perhaps happier.
Oh, definitely happier.
What I'm hearing you say is that chasing the disease, right? We're chasing the symptom of the actual problem. We're not getting to the actual problem. And what the DOs are doing are really, you're getting to the problem, which, wait a minute, there's something in your system that's just out of balance. If we get that into balance, you might not need to ever get to the illness stage.
And I do think there's a place for both. For any MDs out there, I'm not saying that allopathic medicine is bad. I used to work in an emergency room, and when someone was bleeding to death, the job was to stop the bleeding. Mm-hmm. I didn't give them tincture of arnica, right? I mean, there are times when we need to go full court press and save life. And I understand that, so I don't want to sound like it's black or white. But they've shown that the vast majority of outpatient complaints are not these emergencies. People with allergies and, not sleeping well, and they're tired, or they have musculoskeletal pain or some headaches. And a lot of times we are prescribing, pretty heavy duty pharmaceuticals to treat these, as opposed to say, okay, you're anxious. You have an anxiety problem. There are medications for that, but how bad is the anxiety, and is there something we can work on before we go to medications? Or one of my favorite things, including with people overweight, okay, maybe you do need medications right now. Your sugars are out of control. But then while you're on these medications, can we start doing things to help you get healthier so you don't need those medications anymore? It's very rare you'll see doctors coach people on coming off medicines.
Right. I don't see that often at all in my therapy practice. I have people that they have to ask generally in order to come off the medications, not the other way around. But the way that you are saying how you work with the medications is more, again, with this balanced alignment thing. And I think it's what you're talking about with the different types of medicine as well. Not that one is bad and one is good, but there's a place where they can both come together and be more in balance than be in extremes.
Right. And can we be more thoughtful doctors? And again, absolutely not bashing doctors, because I was in the system. They're overworked. They're seeing a patient every 15 minutes, double booked sometimes. And that is really, I think, the crux of the medical problem is time with patients. And I know I have a skewed population because I do have my own practice. I'm not owned by anybody, so I can take as much time as I want to. And because insurance companies won't work with us that way, I also understand that the business side of it for the hospitals, is that, well, if I work on a patient for a half hour, I can charge for a half hour. They can't do that because they're working on the fixed rates that they've negotiated with insurance companies, which is also just not the way medicine needs to be done, right? I mean, if you have an hour's worth of problems, right, you want to be treated for an hour. And if you have 10 minutes worth of problems, then you want to be treated for 10 minutes, and it's legit.
And I think that's where a lot of people are turning to alternatives and trying to understand what else is out there, because they're not getting what they need in like a 15-minute session of a quick checklist. And they're like, wait a minute, you're not listening to me. So they're going outside, and then they go outside and they're like, well, I don't even know who to go to that isn't in the system.
Right. And the part for me, which is special, because like you said, there are a lot of alternative medicine out there, but the osteopathic idea that there's an inherent wisdom in the body. And you can come at that from a very spiritual perspective, but you really can come at it very scientifically. Darwin talked about it. that, through millions and millions of years of evolution, this body, this physiology has developed a way to take care of itself. And I say intelligence in the sense that it's more intelligent than we are, because we as humans don't totally understand it yet. We don't know how a patient has, a tumor that gets better, or even, it's such an amazing idea that we can get sick with a brand new virus like COVID. It's something our bodies have never learned to experience and fight against. And while it was terrible, I'm not saying a lot of people weren't sick and a lot of people didn't die, but it's amazing that we as a population mostly did well with it. And so that's the osteopathic idea, is how do we allow all this anatomy to work at its most functional, and not just gross anatomy. People think about that sometimes like in an orthopedic way, like, are you treating elbows and knees? Yes, but also at that real microscopic level, which is if for example, all your abdominal contents are getting dragged down, we call that viscerotosis. It's getting pulled down. But what does that do to the diaphragm? Because they're hanging off the same fascias. Well, you don't breathe as well. And all the nerves that pierce through there and all the venous drainage is all being limited. And you say, well, I don't know what disease that causes, because that's not what we're talking about. We're talking about optimizing that. So regardless of what you have, you're healthy. Mm-hmm. Because healthy people aren't sick. That's not that's not a major philosophical statement. But if we can make your body healthier, just in general, starting at your feet and working all the way to your head, you say, if I've optimized your physiology, that makes you healthier. And if you're healthier, you're less sick.
Seems like a pretty simple statement.
Right.
This has been great. Any final thoughts? Anything that anywhere someone can start with this?
Yes. So, I'm sure all your listeners aren't all from our area, but, our office, Boston Osteopathic Health, is in Newton, Massachusetts, as well as in Westborough, Massachusetts, and people can reach us there. They can find us online. But other sites that you can use to find traditional osteopaths, you can go to www.cranialacademy.org is a great site. And the other one is the Center for Traditional Osteopathy.com. Two great places to find people in your area. Usually you can search by zip code or state, and that's where I would begin.
Amazing. Thank you so much. I appreciate you being here.
Yeah, thanks for having me, Joe. It was great.
That's a wrap for this episode. Honor what landed, release what didn't. And we'll see you next time on The Healing Blueprint.